Welcome to Be Well. Thank you for joining us today. I'm Jonathon Collopy from the YMCA. And today we have a wonderful opportunity to bring together a group of experts in a particular field. Our helping families thrive with hope and resilience. As some of you may know, April is National Child Abuse Prevention and Awareness Month. We recognize that one of the most important things we all can do to help children thrive is to support families before they reach that crisis. Today, we're fortunate to have this panel to offer a discussion around the concept of hope. I love this acronym. I just became aware of it more recently. HOPE, healthy outcomes from positive experiences. We will have this opportunity together to learn about this evidence-based approach to strengthen families and build resilience for families as well as the community. I'd like to introduce to you our panelists for today, Dr. Wendy Pavlovich. Dr. Pavlovich is from the American Academy of Pediatrics, Chapter 3, co-chair of Committee on Adverse Childhood Experiences. Dr. Pavlovich, thank you for being with us. We have Amy Zeitz. Amy is from the YMCA, Childhood Regional Director of Strategic Advancement. Amy, thank you for joining us today. Brittany Vetter, LCSW, YMCA as well, Youth and Family Services, Program Director, Victims of Crime Programming. Brittany, thank you for being with us today.
Thank you.
Lori Clark, Social Policy Institute at San Diego State University, Chief Program Officer. Lori, welcome. So the format for today, I encourage you throughout our conversation to use the chat function. Use this to add comments, questions. The whole point is that we're able to, with this panel of experts, meet your needs in terms of sharing information and sharing resources. We also will use the chat function to provide to you different links that might be of significance to you. The format will be, we're going to have one guest, one presenter at a time on a particular topic. We'll go into depth on that, and then we're going to move to our next presenter. At the very end, we're all going to come together, have an open discussion, and hopefully respond to any comments and questions that you're going to offer to us. So as we have started, I just want to give a backdrop to the Be Well series is from the YMCA, and it's really about mindful living. And at the onset here, I offer that training our mind to be in the present moment is the #1 key to making healthier choices. And our calm mind is the ultimate resource to take on our challenges. So with that, I'm going to move into our first expert panelist, Dr. Pavlovich, and our other guests are going to turn off their video just for a little bit, and then we'll welcome them back. So Dr. Pavlovich from the American Academy of Pediatrics. I think of the process of parenting, and as a parent, we work hard to do the best we can and really to offer our children the optimal upbringing. And I know often we think of, we want it to be idyllic. We want it just to be perfect. And with that endeavor, I also recognize that health and wellness is not in the absence of adversity. That is the natural course of what happens in life. So I know as parents, we seek to welcome positive experiences in order for our children to develop. So my first question to you is, if you could give us a framework for what is the positive experience, and we've talked about the acronym of HOPE, but share with me positive experiences.
Thank you so much. So, we're coming together today, and as you introduced me, I am the co-chair of our Adverse Childhood Experience Committee. But what we're realizing is, as we think about how can we stop adversity in the big A, the trauma sense, we want to make sure we're really focusing on what are the positive experiences and opportunities. And as you mentioned, we don't want childhood free of opportunities for growth. And growth happens when you have challenges, when you're really in the world trying to do things while being supported in an age-appropriate developmentally appropriate, safe, stable, nurturing, equitable way. So for that, as a pediatrician, starting from really pre-birth and that first baby visit, I'm really trying to get parents to see that child as an individual with full capacity to grow and to think about that interactive environment that they're going to need for growth. So the first opportunity that they need is that relationship with that parent. And so I'm looking in our framework at a child, a parent, and the relationship between the child and the parent. So concrete things that I tell parents is they need to see your face about 8 to 12 inches away. Your face, not a screen, big eyes. They need to hear your voice. They need to feel your touch. They need you to touch them. That's actually part of the early regulation. And this is a positive experience. They learn that they have somebody that's there for them, that's going to nurture, that's going to love them. And then we expand beyond that to how can a parent create a safe environment for them to explore? Are there age appropriate toys? And these do not have to be things that cost. They can be a pot, a pan, a spoon, a colorful blanket. Um, but they have to feel safe, and the parent actually has to feel safe to allow this to happen. And really encourage. We see that child pull up for the first time or take a step in that relationship where the parent goes, "Yay, I'm so proud of you," and has the environment to do that. Then the child can learn their motor skills, their fine motor skills, their language development. This is actually where another concrete tool I recommend is books and reading. You might say, well, wait, 9-month-old? Why are we talking about reading at 9 months? Because again, it goes back to the fundamental building blocks of this healthy outcomes from positive experience. We mentioned relationships, which was one of the first blocks, environment, safe, stable, equitable environment. And now we want to have opportunities for engagement and interaction for that social emotional growth. And books can actually cover a lot of those elements. A parent is sitting there with a child, they're exploring a new world, they're giving opportunity for experience, and then they're having that feedback where they're learning about self-awareness and their own emotional regulation, which actually moves to the next opportunities. Kids need other kids. Kids need peers. And that's one of the challenges that we're having in this pandemic is how even with the littlest ones, do we give them those challenges? I know I was devastated when the playgrounds were closed for a while because that is a great positive experience for exploring nature, touching dirt, sand, trying to figure out how to share that one stick with the other child on the playground. That is an opportunity for social engagement for kids to learn about themselves. So when I'm sitting there as children are growing, I need to change how I think as a pediatrician because honestly, I was trained looking for disease, looking for deficits, looking for signs of ill health, looking for signs of family dysfunction and challenges, food insecurity, histories of abuse and trauma. Now I really, really know from this research informed frameworks that I need to be looking for all those opportunities to support and affirm these positive experiences through asking parents what their thoughts are on this, hearing and listening and noting and celebrating when they're participating in activities that are fostering these building blocks of really resiliency and success, what will make children successful adults.
Dr. Pavlovich, I love the lens in which you're taking on uh, supporting parents and families. It's refreshing, and I love some of the things that you shared. I remember as a young parent myself, the tactile, the 8 inches, the eye contact. So it's wonderful to hear that again and reflect on that. And then I come full circle to where we are today when the pandemic hit and how everyone was isolated and at home and how challenging that was for families and for children. And so when at the Y, when we opened up enrichment, and it was the first time for students to come and be with one another again, and there was a tentativeness, and yet very quickly they came to just being kids and enjoying the experience of being with one another. So I love the four building blocks that you've brought through. What I'd like to do is I'm curious about the research that's been done related to positive childhood experiences and how that impacts those adverse childhood experiences. And I know you're probably very literate of what the research has shown, so I'm curious.
Well, there's definitely needs to be a push and more focus on trying to capture these positive childhood experiences. But over the last decade, many of our national surveys of wellness and behavioral health and the National Children's Health Survey have started to incorporate questions that really look at child emotional social competencies, parent capacities, as well as school engagement, and then also thinking about for adults what positive childhood experiences in their past. And I wanted to highlight some of those because I think it gets to your first question of like, what can parents do? What should we be focusing on as a community? And so I want to put a couple of these out here that were part of the Wisconsin Behavioral Risk Factor Survey. And these were associated with decrease in adult depression and reports of poor mental health. And so ability to talk to family and friends about feelings, felt that a family member stood by them in difficult times, felt protected and safe by an adult in their home, had at least two non-parent adults who genuinely took interest in them. And I really want to highlight this one because when we think about the work of the Y and other community agencies, that's a venue for children to have and establish those relationships with caring adults outside the home. Felt supported by friends, felt a sense of belonging in high school. Now, they excluded people who did not go to traditional high schools, but if you went to high school and you felt like you had a role, you felt like you belonged, that was a positive experience. And then enjoyed participating in community traditions. So I think those are all things that we now have data, an associative study that came out in JAMA Pediatrics in 2019 by Bethel and colleagues that showed a 72% reduction for adults who had in the high category of positive childhood experiences, 6 to 7 of those that I listed in their reports of depression and poor mental health symptoms. And what's powerful about that is they collected data on ACEs, and that held across all categories of ACEs. So that means I could have had many of our adverse childhood experiences and having those positive childhood experiences affected my long-term health outcomes. And so when we think about this time period of brain development and where we know adverse childhood experiences have the biggest impact, let's flip that. Our positive childhood experiences can also have the biggest impact during that time of rapid growth and brain plasticity.
That is profound, some of the results that you were sharing. And I just want to give our guests, so to speak, that are viewing this, the opportunity to go back to some of those things that you brought through. And I believe you said it was the 2015 Wisconsin Behavioral Risk Factor Survey that
Yes.
had the half dozen or so elements that came through that were positive. And so maybe we could have that put into the chat so people can refer back to it, because there's excellent things there. I appreciate how you alluded to the role that the Y and other social service agencies can provide, especially when the significance of having people outside the home and the role that they can play in terms of impacting positive experiences. So that is very helpful. I love the concept of the four building blocks, and I'm just curious, it seems comprehensive, but I want to give you a chance why this framework is useful.
Thank you so much. So, I mean, we have lots of frameworks in public health, advocacy, policy, and medicine. But why this one feels fresh and is useful is because, again, we need to change our lens from thinking about disease and deficits to really thinking about sources of strength, adding and affirming resiliency. this framework also really helps us counsel and learn about our families without stigma, right? So I'm coming assuming that all of my patients and families have strengths, resiliency, have so much value to offer. And by looking at that and asking them about their relationships, their environments, their opportunity for engagement, and assuming that pro-social focus, I'm removing that stigma. And then this framework also helps us think about equity in a different way. Like we talked about a little bit with the pandemic and the different opportunities. I'm seeing my families and patients going back to San Diego Unified School in the last couple of weeks. But I also take care of some kids who have been in school the entire pandemic because they are in different educational environments. And it's really been hard for me when I look at it through that equity of opportunity and knowing how critical this is as a building block to future health outcomes, to see that disparity. So outside of my four exam room walls, I think this is really useful in thinking about equity and racial justice.
So I want to give you a chance just from a practical standpoint, because I know there'll be other physicians that'll be viewing this, just how you use this framework in your practice, whether patients know or not, as a clinician, how you utilize it.
Well, I sometimes am very transparent with patients because they'll look at me like, why are you asking me all of these things? And they'll say, guess what? I actually have science behind this. But what I'm trying to do in all my well child visits and other visits that I have, especially with those school age kids, is to make sure that I'm assessing for strengths. So directly to the kid, I'll ask, what are you proud of? What do you think you are good at? What have you been working really hard at? And one very shy little boy who didn't tell me, but his mom immediately piped up and was like, he is a fantastic storyteller and he remembers all the details. So I've just created a moment of pride for both him and his parent on this. I ask children, how do they contribute to their family? What does their family need from them? How do they help? And when parents or child brings up chores and responsibilities, then I reinforce that and say, you know what, that's great. You matter, you're contributing, you're learning skills for confidence, because I want parents to understand that it's okay to take some risk and let their kids try new things because they need that to develop skills, their confidence, their competence, which will then translate into self-esteem. For the parents from the beginning, how are you is the first question. And then, who would you call at 2 a.m. if you needed something? Who's really helped you this week? What have you done for yourself? Honoring culture and history. I had a parent from Ethiopia the other day who I know very well. And I was just asking her how things were going. And also, as her kids are getting older, were they speaking their home language in the house, and talking a little bit about what they thought about that, how they were planning on sharing their cultural heritage, what kind of connection she had back with her family that's still living in Ethiopia, and saying how important that is for them to engage, celebrate, transmit that cultural heritage. Because as we know, that's part of children seeing themselves in a positive light and having that connection. And as we were talking, she looked at me, she's like, you have work to do. You don't have time for this conversation. And I was like, yes, I do, because I think that this is really critical to, all three of your children really growing with a sense of pride. And that will help their health overall. So those are a couple of concrete questions that I am trying to make sure that I weave into all of my visits with my patients.
Great examples, Dr. Pavlovich, and I could hear in your voice the sincerity and the authenticity. When someone asks you how are you doing, often that's a social grace, but when you share it, there's a depth to it, and I can see people, really responding to that in a compassion, because you're coming from such a compassionate place. Dr. Pavlovich, we'll come back to you in a little bit. Thank you very much for your sharing. We're going to bring up Amy Zeitz. Amy is from the YMCA Childcare. And so, we were talking about the whole idea that as parents, it's not always an easy process to raise our children. And it is quite a journey. So from your professional experience, how do adverse childhood experiences come about? Because I recognize we're all at risk and all vulnerable at any given time in terms of different challenges that we take on. But from your professional experience, how do you see those adverse experiences emerging?
Yeah, thank you. I'm probably going to echo a lot of what Dr. Pavlovich just shared so eloquently. I think about intergenerational cycles that get sort of perpetuated, both positive and negative. And I think it's important to just know, that this is Child Abuse Prevention Month, and how important it is that not just in our individual practices, but also as a community, that we work towards not just child abuse prevention, but really um, interconnected systems and partnerships that foster child and family well-being. Because I think what our opportunity is to disrupt those cycles is really around responsive relationships and the four building blocks that Dr. Pavlovich mentioned, but also just really leaning in to healing and restoration, right? So what I have seen in my 20 years of being in social services and my training as a marriage and family therapist is that I have never once encountered a parent who didn't want to be the best parent possible, that didn't want the best for their kids and for their families. But things get in the way, right? Their own histories, their own traumas and adversities, challenges related to living in a city that is very expensive. It's hard to make ends meet. And we know that there is a lot of racist history and discrimination and oppression built into a lot of uh, systems around opportunity. And so all of those things impact the ways in which we can show up for our kids. Um, I would just also mention that here in San Diego, most of our substantiated cases of child abuse and neglect are for neglect, and they are in the 0 to 5 space. And I think it's really important to separate out neglect from the impact of living in poverty. And so for me, I think a lot about what are the ways in which, as a community, we're set up to support families where, when, and how they want, and before they hit moments of crisis.
So, Amy, if I could go a little bit deeper in terms of the statistics that you just brought forward here in San Diego, that 0 to 5, one of the highest incidents of adverse experiences is neglect.
Mhm.
And if we were to look at that in a finer way, what might be the backstory to that? What might be the reasoning? I can think of a lot of different things, but I'm just curious from your perspective.
Hmm. Absolutely. Well, I mean, we can think about things like, I mean, the first thing that comes to mind is as a parent, if I'm, really stressed out and struggling to make ends meet, to make sure there's food on the table, to make sure that I can pay rent at the end of the month, I probably have some pretty limited capacity to be responsive in my relationship with my child. If my kiddo is having behaviors in their childcare setting, if I'm lucky enough to find affordable childcare, um, and my kiddos having behavioral things happen in that setting, and now my childcare provider is saying, oh, if this doesn't change, this might not be a fit, which is, essentially a suspension or an expulsion. Now all of a sudden I'm saying, oh my goodness, what am I going to do with my kiddo? How am I going to keep my job? And so then the ability to respond to the behavior, which is a call for a need, right? So and a lot of times it's very developmentally appropriate. So I think that's like one of the examples of how that can play out. The urgency and the desperation to stay on top of things from a financial perspective can really impact all the four building blocks that we know are so critical, just from a capacity perspective.
Great point. I just think of when we're not able to be at our highest resource, it's difficult to then be able to care for another at our highest resource. And especially the year that we've come through and are still coming through, and there'll be some residue from some of this. I'm very curious about those kind of, as you've spoken to before with me, the whole idea of protective and promotive supports. and how critical those would be. But if you could describe some of those for us.
Yeah, absolutely. So similar to the research that Dr. Pavlovich described for both the four building blocks, she also described what some of the research is showing around positive childhood experiences. We also know from research that if these five main protective factors are in place, the research shows that families, children and families, have higher rates of well-being, or higher sense of well-being, more optimal child development, and decreased likelihood of child maltreatment. And so those five protective factors, I'll sort of describe each one. The first is around resilience. So the ability to navigate through everyday challenges, right? So whether that is pivoting because of a global pandemic, or it's finding, being resourceful in solving a problem. My car broke down. I do or don't have social supports around that. What do I do? So that resilience piece, I think, is really important. And I would just say a lot of times folks define resilience as the ability to bounce back. And I would just share this alternative definition to hold in mind, which is the ability to transform through challenges, right? So this idea that, like, maybe we don't want to go back to where we were, but how can I continue to grow and evolve in my skills and perspectives through these hard times.
Excellent.
The second protective factor is concrete supports in times of need. And this is just the idea that every family at some point in time is going to need something, right? So what Dr. Pavlovich was talking about in terms of reducing the stigma, the assumption that everyone walking in the door is going to have something going on and has gone through something in the past, right? So this can look like childcare subsidy to pay for childcare. It can look like needing nutrition assistance for time being. It can look like education and workforce development supports for the grown up. It can look like all of the things that are the basic needs that can impact parental stress. The third one is around parenting and knowledge of child development. So, I always say, and I'm sure others do too, that kids don't come with a handbook. I have two kids, they are very different. I've had to cater my parenting style to each of them because they have different needs. And there are times where I have to get my books back out, right? Because I have responded in a way that then I realize, oh, wait, I got to ground this in child development. So the idea of a 2-year-old biting, it's actually developmentally appropriate, right? And so how do we lean in to build emotional competence and literacy, and while their verbal skills are being developed? Because the biting is a frustration, right? So how do we get down to that? And so that child development piece is so important, because when we don't have realistic expectations of our kiddos, we can get into these really negative cycles of interpreting behavior in certain ways that are sometimes not productive on either side. The fourth protective factor is social connection. So the idea that we are relational as human beings, and that we all need nurturing, positive, and loving relationships to be in. And so how do we continue to foster those in both formal and informal ways? And then the last one's around social emotional competence, right? So we know that the ability to manage emotions and regulate is super important. And we also know that those of us who have maybe not grown up in the most optimal childhood environments ourselves, sometimes we need to do some work to be able to show up for our kids in the ways we want to, in order to co-regulate with them and model and coach them in building those competencies.
That's excellent. I was thinking about, as you were sharing, the need to kind of go back and research. Both my wife and I were family therapists. I taught child development. We studied this in college. I thought I was well prepared. Yet, children, both of them very different in what they offer. Our hope was just to stay a little bit ahead of them and make sure they were offering, the best that we could offer. So I appreciate the sketch that you provided, and the need to have resources and support, how critical that is. So if you were to integrate what you've shared and share with us what we should be taking away from that, would be the first thing I'd ask you. And then I wonder how you get this information into out to families and provide that out in the community so people are aware of these important elements.
Yeah, thank you. You know, at the core of, like Dr. Pavlovich had said, also there are so many models out there. There's the protective factors, there's the promotive factors, there's the positive childhood experiences, there's the hope building blocks. The thing that is at the core of all of that is just responsive relationships, right? Where we are continually increasing our own self-awareness in order to be in relationship in ways that are responsive to our kids, to our partners, um, to our social supports, right? So this idea of responsive relationships, I think, is just the most important. And we get this out in a couple of ways. So we'll provide a protective factors resource document with some concrete examples. We can send that out afterwards. And within, we also are stewarding a 5-year federal grant called Partners in Prevention. So this is a community-based effort to really think about how do we increase protective factors with families, and thinking about how do we better improve access and utilization of services, and make sure that we really have a continuum of services that families can access where, when, and how they want them before they hit crisis, right? That is just, at the end of the day, what we're hoping to do. If we're doing good child and family well-being work, we're going to be doing really great child abuse prevention work. And the last thing I would just say is that at the Y, we offer lots of concrete supports. As I think, when I think about the 5 protective factors, I think we do a lot of that at the Y, certainly within Child Care Resource Services as an example, but also across all of our Ys in terms of being able to connect, being able to take care of ourselves, make sure we are refueled so that we can show up as our best selves as parents.
Amy Zeitz, thank you very much for what you've offered us. We'll circle back to you as well in just a little bit. Thank you, Amy.
Thank you.
I have Brittany Vetter, LCSW Youth YMCA Youth and Family Services. Brittany, thank you for coming back on.
Thank you.
Just for really the common challenges and the journey that all of us parents experience. I know the Y and Youth and Family Services provides really specific programming to foster family wellness. And I believe it is identified as the Family Resiliency Center. And I just wonder what you can share about the program.
Sure. As some of you may not know, the YMCA of San Diego County does operate a social services branch that we call the Youth and Family Services. And in that, at that branch, we do operate a program called Family Resiliency Center. And it is really shaped around some of the ideas that I've heard today, that parenting is hard, raising children is hard. And so it's a parenting support program with the idea of preventing child abuse, but also strengthening family relationships, the relationship between a child and their parent or caregiver, and really building skills. So it's more of the intervention piece to some of the things we've heard today. So, maybe after someone is seen in their well child visit and needs to be referred maybe for some more specific care, or maybe attending a YMCA camp, and just because they have a relationship with the YMCA, staff members are getting to know them a little bit better and say, hey, what about the Family Resiliency Center that can work with you more one-on-one on accomplishing some of those goals that you're trying to reach, or just feeling more in control as a caregiver. When I heard other people speak, I think it's the idea of when we feel out of control. So whether it's because our basic needs aren't being met, or because our emotions are getting the best of us, because our child is being threatened by school staff or childcare staff that they can no longer attend, and things like that. It's really the main idea of being out of control. So, we hope to be able to give a sense of control back to the families.
So that's wonderful. Is there a particular scope of services and interventions that the Family Resiliency Center offers? And And I wonder what it would look like for a family to be involved in the program. If you give more examples concretely.
Sure, sure. Our idea is to really kind of round out some of the services at the YMCA. So it can look a little bit different depending on the family, but we do offer individual family visits to the home to work on parenting strategies, really understand the family system. I think we really come from this idea that each family can be so different. They can grow up in the same culture, the same neighborhood as someone else, but really understanding the nuances of that family and seeing how we can help. So we can do home visits. There's some groups for parents, groups for children, and we even have this opportunity to connect with some of the YMCA branches and their enrichment programming or their camps. So, if a child is really having a hard time, or a family's having a hard time, how can we be on site to support them so they can succeed there as well?
One thing I remember you had shared with me and I was impressed with is that you do like a parenting assessment.
Yeah.
To get a sense of how our parenting has been conditioned and shaped.
Yeah. So, I think really asking how parents are doing is a critical component, but also, we're in the mental health field, or I am in this program. And, we really believe that our parenting is shaped, right, by many generations before us. So a lot of our effort in the beginning when we do meet a family is really understanding their family values, their family culture, how they were shaped as a parent. And maybe they are the first person in their many generations that's trying to do something different, right? So which can be really hard. So, wrapping around them and kind of aligning with them and nurturing that really scary place of trying something different and wondering if it'll work. So
I know when we had the moment to talk earlier, you were sharing how there is the need for the whole family, the whole system to be involved. And if you can share the reasoning behind that.
Sure. Similarly to what I had said before, we are shaped by our experiences and what I've heard on this call today. From very early childhood experiences have shaped who we are as parents, as partners. And so we really have to understand the whole system. Again, I said the nuances, and what I mean is that emotional experience within a family system. So those nonverbal experiences where you're just giving someone a look and someone else is reacting to them. Or those moments when in one family, there could be a behavior that a parent is, saying, oh, well, and then another family, it is devastating, it is triggering, it causes reactivity. And so we have to understand those nuances within the whole system because everything is at play. And we can't think about it as changing one part and hoping the rest follows. We have to look at it from a holistic approach. So.
Those are important examples you're providing. As you were sharing that, I was reflecting, and I would think others would be reflecting back on our family of origin and sitting around the dinner table and some of those dynamics that you spoke of, and even within a family, how it can be charged or triggering for one member and maybe not another member.
Mm-hmm.
Brittany, how does someone find out about, get involved with, or referred to the Family Resiliency Center?
Yeah, the YMCA of San Diego County website under our behavioral health or youth and family services pages can lead you right to me. And we actually offer a variety of counseling and mental health programs among other social services. So I just encourage people to take a look at the website and reach out for more information.
And then I look at, I know the work of all of these different practitioners is really to ensure that there's not gaps in the delivery of services. So what would that mean for the Family Resiliency Center to ensure that this is comprehensive?
Sure. We've had traditional mental health therapy programs for many years. What we did feel like we were lacking was this experience that families could have. I don't want to say less intense, but maybe they weren't ready for traditional therapy services, but they were coming to us with a child behavior or an experience, and they just wanted to consult. They wanted some help. They wanted maybe a social support system with other parents who were going through the same thing. Wanted specific feedback on how to manage behavioral issues or things like that. So really just trying to round out the stages of change that a family might be in. So then the Family Resiliency Center came about.
How can, if you could speak to equity and how equity comes to play in terms of intervention and support services?
Sure. I think for some families, the path has been so well paved on how to raise a productive, successful child. And for others, the path has been much more bumpy. And so we're really trying to continue our belief in the family system, in that each family is different, even if they grew up in the same neighborhood, even if they speak the same language or come from the same race or ethnic background. There are nuances within that family that we need to learn about and understand and be curious about. The services that we offer at the Family Resiliency Center are free to those who qualify, who are interested in improving their family functioning. So we hope that reduces barriers to people accessing our services and other mental health services.
Wonderful. Brittany Vetter, thank you very much. We'll see you again in a moment or two, but thank you for sharing about the Family Resiliency Center. Our final presenter for today is Lori Clark from the Social Policy Institute at San Diego State University. So for us thus far, we've had the opportunity to talk about a number of different systems. Now we're going to move to a broader systemic perspective. We're going to talk about communities come together to build resilience. I think a unique and inspiring proposition. I know the Social Policy Institute is involved with PIP, Partners in Prevention, and has been an ACES award grantee. In addition to this important work, can you share your perspective on how communities come together to address adverse childhood experiences?
Sure, I'd be happy to do that. And just thank you and appreciation to my fellow presenters on the panel. It was so moving to hear the compassion and the excellence that you brought into your comments today on how we're really addressing these concrete needs of kids and families. And the Social Policy Institute is pleased to be a university partner in that, because our mission is actually to bridge academia with business, government, the community, to increase the well-being of children and families, and also in the context of community. So as we work together, we have a great opportunity to expand that. So the role of community for me is not just public or government programs. It's not just community providers, but it's every single one of us as neighbors, because we all live in communities. And the things that you've heard here today so far, many of them have practical application for how we support each other. I think if nothing else, the global pandemic has taught us that we belong to each other and that we're in community. So this part of building community resilience, I think, is really critical, because we do have a dual role, as I began to say, not just to recognize and respond to the needs of kids and families, but also to change the conditions that they live in. So one of the resources I'd like to share with you is our Knowledge to Action brief on the pair of ACEs. And this is really talking about one set of ACEs, which are the adverse childhood experiences that have been described today, that give expression in child abuse and neglect and other kinds of household and family dysfunction. But the other ACE that we don't talk about as much is adverse community environments. So if you think of this as a tree, that the fruit of this tree are the adverse childhood experiences, but the root of it is grounded in community. It's adversity such as racism, discrimination, poverty, crime, other kinds of conditions that exist in the community that can often give rise to toxic stress and the ACEs. So our role, both as providers and as citizens of one another, is to work to change those conditions, to advocate where we can, to directly change where we can as well.
I know you're drawing from, I think it's the Milken Institute you had shared with me, and Wendy Ellis's work on paravases, and that analogy, that symbol of the tree of adversity is poignant. I know there's other work that the Social Policy Institute is involved in building community, and I think you have a toolkit that you wanted to share with us, and I think we'll put some links in the chat related to that. So Lori, share about that toolkit.
Thank you. I appreciate having an opportunity to talk about that, because we must go beyond just talking about it to doing things in a practical way. And so the Social Policy Institute, with other partners, developed this toolkit in order to have a concrete fallback, concrete resources for our partners to know what specifically can be done. And it's almost to have a menu of options. So every single step doesn't need to be started at the beginning, and you don't have to hire a facilitator to come in and work with you. The toolkit with the link in the chat there is accessible to everyone. And based on the work of Ellis and Dietz, it basically covers 4 areas or 4 components of building community resiliency. The first is building a shared understanding. So in the toolkit and in the handout that we'll also provide you a link to, you find some very practical ways of doing this. These tools include things like discussion guides, ways of doing key informant interviews with community leaders to know what they're already doing and to be able to link that together. So the shared understanding, or getting on the same page of what are the conditions in the community that are most impacting parents and what are we aiming to do about that, is critical. A second is assessing our own state of readiness. And Brittany, you talked about stages of change with families. We have those same stages of change in community partners as well. And it's important to look at that and where necessary to increase our motivation for working together. Thirdly, we provide tools in gathering cross-sector partners, because each one of us has a role to play in changing and improving the conditions in communities that impact kids and families. No one system, no one provider, no one individual can do that single-handedly, but really it's all working together. And then the final component here are tools around building community, so that it's not a matter of us as organizations or as a university changing a community for families, but rather it's partnering with families to make the change that they want to see in their own community, and to do that in a sustainable way. This is where we equitably and respectfully lift each other up and create those opportunities.
I think it is important how you have brought through the concept of that dual role that each of us has. And in sharing that, it's empowering for us to make a difference in our particular community. I know that the building community resilience the toolkit is already being employed in various communities. And I think you've shared it's set up in a way that it can be tailored and expressed in a lot of different ways. I just wonder if you're aware of any research that's being done. I think you had shared that each setting is working on particular factors that they're looking for. But I'm just wondering if we're aware of the social impact that it's having already.
Sure. Well, I certainly want to defer to my colleagues at the Milken Institute. Wendy Ellis and Bill Dietz are doing that ongoing research on an extensive way across the country as that implementation is rolling out. So I refer you to their work, and they will definitely be a resource on the general and collective themes that are emerging. Here, more locally and in California, there are various counties that are doing work through the Office of Child Abuse Prevention to have a countywide prevention and wellness plan. And so a few of those prevention counties are using the toolkit and selectively using tools within the toolkit to help build out their partnership, help create the shared understanding with a focus of not just serving and supporting families in a direct way, but also changing those community conditions. So if anyone would like to see some of the continuous quality improvement data or evaluation on those counties that are using it, I'd be very happy to connect you on that. So feel free to reach out to me. There's also a statewide work group on building community resilience, and that will be another place to learn more and contribute more.
Thank you, Lori. Excellent work. I'd like to have all of our panelists, if they would come back on. I know that our time is fleeting. This is important to information and resources that are being shared. I am struck and impressed really with everything that's being done in each of your commitment to this. I just want to open it up in terms of anything that we haven't brought forward that would need to be brought forward, as well as I want to know what are the next steps. I know you've talked about there's all these different paradigms out there. And I just wonder what are the next steps that we might be identifying that further work is needing to be done. But I open it up to all of you.
Well, I think one of the next steps that occurs to me is just taking a moment to reflect on our own commitment to make a personal investment in supporting child and family wellness and improving community conditions. It's sort of easy to get a part of an initiative or a program or a work group that's looking at that. But again, each of us individually as well as professionally has a role to play. So I think an excellent starting place is just to pause and review and renew one's own commitment.
Excellent.
So I think the theme here is relationships and relational care, right? And so in the healthcare workforce, you know, adopting a trauma-informed care approach has been a step, but we need to move that to a resilience and trauma-informed care approach, and then really look at our systems that undermine relationship. And one of the first things that comes to mind is, you know, those anecdotes I shared with you were only possible because of the relationships I had with those families. And there are so many things in our healthcare system, whether it be payment structures, insurance changes, scheduling, that interrupt that relationship. And that's why I went into pediatrics, because I could have 18 to 20 years of relationship with a patient. So that's a zoom out commitment for me, is to keep putting the resilience into trauma-informed care and to really look at how we disrupt the relationships with our current system.
Thank you.
Yeah, I would echo that. I think as we evolve from COVID response to, I don't even know if recovery is the right word, but as we transition again, just keeping children and families at the center and truly partnering and sharing in decision making around what rebuilding looks like that is strengths-based and resilient-centered. I think that is just the only way to go, and we will miss the mark on equity if we don't do that.
Thank you, Amy. And if I was just to follow up, noting the pandemic, there's been a lot of discussion about the second pandemic, a mental health pandemic. And so I just wonder if there's anything unique that we're needing to look at or bring forward as we come through this period of time.
Yeah, I really appreciate that question. I'm sure Brittany has something to say on this as well. But I would just say, we know that the most critical brain development, 90% of brain development happens in those first 5 years. So for kiddos who have missed out on those social emotional development opportunities for the past year, we have some really important work to do, both with children and families, but also with those who care for our families. And that includes also not just our health and social service providers, but also our child care providers. I would just put out a specific resource. We have a warm line right now open for parents who are interested in, they might not be ready to participate in services like Brittany described, but maybe they just are ready for a little bit of social connection, needing a little bit of support around accessing resources, understanding what's out there. And I think just slowing down, right, to be with each other is like what I think what Lori also said. So yeah.
The only thing I'll add to that is just reiterating that mental health healing intervention doesn't have to be complicated. I think, as we've heard, finding a connection, talking to someone else about an issue, having a playful moment between a child and a caregiver at soccer or other things like that, reading to your child, getting back to the basics. So it doesn't have to be this kind of intense experience of therapy and intensive therapy and things like that. It can be pretty simple for some people if we can get back to some of those basics.
I appreciate how all of you have really made this something readily available that any one of us can enact. It's a relationship, it's engagement. It's very simple. It's not a difficult process if you do it in a mindful way. I just want to close. I'm so fortunate. I'm really honored to spend this last hour with each of you, and I am grateful for the resources that you've offered, your expertise, and most important, your commitment and investment in making a difference and bringing resilience to our families and to our community. So I thank all of you for being with us. I look forward to another opportunity where we can all come together again. But for today, thank you very much for offering yourselves.
Thank you.
Bye-bye.